Welcome back, everyone. I hope you all ate. I know it was a very productive break. I really enjoyed seeing all the conversations and the connections that everyone was making. We have a wonderful afternoon session now to wrap up the day. And I'd like to begin by welcoming Dr. Megan Ranney here, who is the Dean of the Yale School of Public Health, to join us in conversation for an ongoing conversation. And you don't really need an introduction, I think, to this group, but because there are 2,000 people at home, can you maybe give a brief introduction of who you are and how you're here?
Sure, thank you. Thank you so much for having me. It's an absolute joy to be here. I've been here since your first Northwell convening and am so impressed, as always, by the energy, enthusiasm, and commitment to solutions in the room. I am an emergency physician by training, as well as an injury prevention researcher. I've been working on violence prevention since the start of my career and actually long before I became a physician or a public health specialist. I spent most of my career at Brown, where in addition to doing academic work, I started a nonprofit called Affirm, which is now at the Feinstein Institute, which was back when we started it in 2017, really the country's first nonpartisan nonprofit dedicated to addressing gun violence as a public health problem. Long story short, ended up moving to Yale about 7 months ago, where I am unbelievably privileged to be the Dean of the School of Public Health, with gun violence prevention being amongst the topics that we are incredibly committed to addressing, and have been fortunate to work with many, many of you in this room over the last 20 years, and I'm so excited to be here with you today.
Thank you. It's really wonderful to have you here. We really appreciate the passion, the energy, the work that you've accomplished and are accomplishing. I think to start this conversation, just to break it up in a time, let's maybe look back. There was a time where gun violence, firearm injuries were not viewed as a public health problem. We didn't think of it in that lens. We've heard a lot today about it. There wasn't funding from Congress. It wasn't really on the radar. How did that shift happen? How did that change happen over the ensuing several decades that took place?
Well, I think I'll quote Michael Dowling here, which is that great things don't happen quickly. So it has been decades of work, real determined work by physicians, nurses, social workers, psychologists, criminologists, survivors, to redefine how we approach gun violence. So I'll kind of reflect back on the beginning of my career. When I first started working on this issue in the early 2000s, I was told in no uncertain terms by very well-meaning mentors to not talk about gun violence as a health problem. Right? This was only a few years after the Dickey Amendment had been passed. One of our great colleagues in emergency medicine, Art Kellerman, had seen all of his funding pulled and had essentially been blackballed from federal funding as a result of the Dickey Amendment. And people were trying to protect me. I know Emmy Betts, who's in the back of the room, a fellow emergency physician, got told the same thing. And so a group of us kind of started creating an informal collaboration. There are some of you in the room, I'll highlight Charlie Brannis, who continued doing this work despite those prohibitions and served as kind of touchstones for us who were interested in it. But we started working behind the scenes. And then, of course, Sandy Hook happened. And Sandy Hook served as a moment that woke many folks up that we needed to talk about this. I remember in 2014, we held our first ever gathering of healthcare professionals talking about gun violence as a health problem, filled a room at the Mass Medical Society, and then things kind of fizzled from there. We then brought together groups of researchers. There were a dozen of us in a room, started trying to write grants, started trying to advocate for federal funding. 2018, American College of Physicians put out a paper that has now become well known by most, talking about gun violence as a public health problem. That incited a tweet by the NRA, one of the few times that I will thank the NRA for telling self-important doctors to stay in our lane. As many of you know, Joe Saccharin, I, and many others created and kind of led a "This is our lane" hashtag that was really potentiated by thousands and thousands of healthcare providers, many of you here, that raised public consciousness about all of the ways in which gun violence is very much a health problem, not just for survivors, but for families, for healthcare workers, for communities. And not just the actual bullets that hit someone, but also the ones that miss and the trauma for community. go, go, go. And now we are at a point where we have a Society for the Prevention of Firearm-Related Harms that started, again, from that dozen researchers in a room. We had more than 800 people attending our conference last December. I invite all of you to join us in Seattle this coming December. We have this group, which is extraordinary. I mean, as Michael has said, when you created this, you did not have many CEOs in the room. You did not have people signing on. And now look where we are. Yeah. We have federal funding. We have had $25 million a year appropriated to both NIH and CDC for the past 3 years, hopefully again. So there's been a lot of really great stuff. At the same time, as others have talked about, we've seen increasing rates of gun deaths and gun injuries. A recent KFF survey says more than 50% of American adults have someone in their immediate family who has been shot or has been at a shooting. That's not counting all of us who have non-immediate family members, right, who are not part of our nuclear family. And we have more firearms in private hands than ever before. Most recent estimates are approximately 500 million privately owned firearms in the United States. And so we've had some tremendous successes over the last 2 decades, but also some real continued challenges.
Yeah, so maybe we'll stay with that. We've made real progress, and yet in this year, it's not even March, we've had 5,000 or more shooting take place. We've had over 50 mass casualty events. Obviously, the event in Kansas City sits very visibly to many of us in the country. Where are the gaps now that we need to really start to pay attention to today as we sit here?
I love that question. So I'm going to actually start with a positive, which is where are the great, amazing things that have been done. So I mentioned the federal funding, right? So we've seen, along with that federal funding that has been released, we've seen a more than 90% increase in the number of publications, a significant increase in the number of clinical trials that are being registered in parallel with the release of federal funding from NIH, CDC, but also, of course, NIJ, as well as private philanthropists, many of whom I know are in the room today. So there's been an incredible growth in research and evidence. And there are some amazingly positive things that have been piloted and that are actually being done. And I'm going to highlight a few, like the other panels talked about a few, but there's some things that haven't been mentioned. So greening of urban spaces. Charlie, Gina South, who's down at Penn, have shown that when you put gardens into vacant lots, when you rehab abandoned buildings, you see decreased violence, but also decreased stress and depression in the neighborhoods around where those interventions are done. An unbelievably simple intervention that makes a difference. The rise in community violence intervention programs and the data that's coming out about what works and how to train people. When I look at the Crime Lab or at Arnie Duncan's group, CRED, and the great evidence there. The work that's being done around credible messengers and creating partnerships with the gun-owning community is transformative. Emmy Betts, Mike Anestis, Chetan Satya in the room, doing great work on getting the message out on how to screen, how to counsel, how to intervene in ways that also respect Second Amendment rights. And we have groups like the Aspen Institute that just released this Aspen Health Strategy Group report, which if you haven't read it, it's extraordinary, laying out 5 big ideas for how the health sector can tackle gun violence as a health problem. This was led by Bill Frist and Kathleen Sebelius. Alex Azar, former Secretary of HHS, sat on the commission as well. A real beautiful example of bipartisan agreement on where we can move forwards. So I think there's a lot of great stuff, a lot of great positive projects out there that we've kind of shown can do something, so then that goes to where the gaps are, which is we're not putting it into practice. And of course, this is the problem with public health and health research in general, is we show that something works, we do the pilot, we do the NIH-funded study, maybe a community group gets a short-term grant from SAMHSA or NIJ, or they work with an academic center, and then the grant goes away, and you leave the community high and dry. And so I think where the gap is us translating these unbelievably promising programs into actual action on the ground, regardless of whether we are getting federal research dollars for it. It's how each of us in this room can commit to working with the communities that we live, work, depend on, our coworkers, our colleagues, to put these programs in place. And I should say to put the programs in place that we know work, not to put in place the programs that we feel are emotionally satisfying. And I'll highlight here gun buybacks as an example of something that many people come to me and say they want to do, but there is literally no evidence that they make a difference in rates of gun violence or gun death. So take what we already know and commit to putting it out into the world. So that would be the first big gap. The second big gap is around talking about mitigation of trauma and fear. Jonathan Metzl just wrote a great book, which I recommend reading if you haven't yet, talking about kind of the path forward for gun violence prevention. And he highlights that part of public health is public safety. And when we look at the rise of gun violence, the rise of gun violence purchasing in this country, so much of it is tied to fear. David Hemingway did a study back in the 90s showing that youth overestimate the number of other high schoolers who have guns in their high school. And if they think that other youth are carrying, they're more likely to go and carry themselves. So how do you change that norm? How do you change the fear that, again, 50% of adults have someone in their immediate family, but all of us know someone who's been affected by gun violence? How do we change the fear around civil society? Like, that's a huge gap that I don't see people taking on. How do we help with the fear of healthcare workers? The night before COVID, I had a man that shot and killed himself in my waiting room bathroom. I'm an ER doc, right? And so I was coming on shift. So the night before our first COVID patient, we had that happen. My nurses were terrified to go back out to triage. So how do we handle that and the trauma that we've all faced as healthcare workers if we're gonna make progress? That's a space that I don't see a lot of folks working in yet and that I would love to see us go deeper into.
Yeah, no, it's important to take care of ourselves as healthcare workers so that we can carry on the work that we all do. As you think about moving forward and looking down the line, how do we need to change the way we talk about public health? Do we need to change what it means to say that gun violence is before it wasn't public health, now it is public health. Maybe that connotation has changed to say that it is a public health problem. What should the future look like? How do we think about this problem from a public health lens?
I would welcome your insights and that of the community as well. I have some biases, being a dean of a school of public health, but I will say, so I testified for Senate Judiciary Committee in November, and Dick Durbin brought us together, and it was about gun violence as a public health problem. And we had obviously Democratic witnesses and Republican, and we got through. And I realized about halfway through the hearing that folks didn't actually understand what the public health approach was. I think coming out of COVID, people know the term public health. And again, people think of gun violence as a public health epidemic. But they think that what that means is that our one job is to pass laws, which matter deeply. But legislation is part of the public health approach. It is not the entire thing. And so I do think there's a moment to redefine and to expand how we take that kind of public health lens to be to be about kind of resilience and health promotion and safety, in addition to kind of the legislative side, which of course is deeply important.
Thank you so much for your time, for your work, and for sharing with us this afternoon. We're going to move on to the next part of our program. Thank you all very much.
Thank you.
Thank you.